morning, everyone. My name is Julia Romero. I am currently in the psychopathology class with Professor Klein Peter, and I will be discussing generalized anxiety disorder, GAD. Today, I will be discussing an introduction and brief overview of the disorder, generalized anxiety. I will be discussing 3 different treatment options that are commonly used for generalized anxiety. I will also be discussing the goals of the treatment outcomes, some cultural and environmental factors that may impact the diagnosis of generalized anxiety disorder, and I'll be reviewing a conclusion for future implications. First and foremost, the overview of generalized anxiety disorder. By definition, generalized anxiety disorder, GAD, is a mental illness that features excessive anxiety and worry for at least 6 months, occurring more days than not in an individual's life. Individuals who experience GAD or generalized anxiety disorder may find it difficult to control their worry and must experience 3 or more of the following symptoms. The symptoms are restlessness, so getting tired easily fatigued, not being able to focus, difficulty concentrating, irritability, getting upset, muscle tension, and sleep disturbance. Again, these symptoms have to be occurring more days than not over the course of 6 months. The effects of GAD are quite significant in individuals. Due to the disturbance in thoughts caused by worry and anxiety, there are impairments in an individual's life. Individuals who experience GAD or generalized anxiety disorder are often impaired at home and within their working setting by intrusive thoughts and tiring thoughts of worry. Treatment options. For generalized anxiety disorder, there are 3 main treatment options that are discussed within literature. The first is psychosocial interventions, the second is psychodynamic therapy, and lastly is family involvement. Each will be reviewed in the next slides that follow. For psychosocial intervention, the most commonly used psychosocial intervention for generalized anxiety disorder, GAD, is cognitive behavioral therapy, CBT. Cognitive behavioral therapy does follow a very structured guideline and has a limited amount of sessions. Typically, CBT follows 12 to 16 sessions, combining individual and group experiences, depending on a client's treatment planner. Within cognitive behavioral therapy, or CBD, the clinician will provide psychoeducation or insight onto generalized anxiety disorder and its origin, monitor symptomology, so the clinician will follow and watch and observe the different symptoms that may arise in the client's life, integrate cognitive restructuring of the body's sensation responses. So this is involving how do we shape our brains differently, how do we change our thoughts in response to how our body is feeling. May offer breathing retraining, so this focuses on the different panics that may come with generalized anxiety and how do we practice deep breathing to help our bodies calm down. Progressive muscle relaxation techniques. This is a process of which we tense up our body and then we release all parts of our body correspondingly from the top to the bottom or from the bottom to the top as a solution for relaxation. Next, problem-solving strategies. The clinician will guide the client in developing solutions for the problems that they may experience on a day-to-day basis, and expose the client to feared objects that may trigger anxiety-like symptoms within the client. This one talks about exposing them to feared objects. So, for example, if a client is scared of bridges or spiders, this exposure therapy might expose the clients to those aspects and talk with the client on how they might move through them easier or utilize different coping skills so they don't feel as anxiety provoking in the future. Next, for psychodynamic therapy. Psychodynamic therapy is a combination of psychoeducation and medication involvement. Psychodynamic therapy focuses on educating the individual on anxiety, where it's from, the functioning of anxiety, and how to live with anxiety on a day-to-day basis. This model does incorporate the use of interventions as seen in CBT, but it also incorporates medication involvement in the individual's day-to-day life. Psychodynamic therapy, or the use of psychoeducation and medication, is currently readily available to clinicians and requires a little bit less effort from the individual's participation because that medication does aid in relieving some of that symptomology. It is important, though, to include coping skills and strategies for the individual because sometimes clients may have different responses to medication depending on medication type and dosage. This type of treatment is often used in adults, however, because it does involve medication, and oftentimes parents of children with generalized anxiety disorder are more hesitant to prescribe medication to their children. Lastly, family involvement. This one really focuses on children and families. Because children do live with families of some type and their parents, it is most commonly used within children. So if a child is diagnosed with generalized anxiety disorder or GAD, parent-child intervention should be used to implement and parents need to be educated on what generalized anxiety disorder is and how to best support their children. Parents may help in this process or aid in this process by helping a child face new challenges when he or she may be apprehensive, helping to decrease and talk down negative self-talk, and encourage the child to play and engage in activities that they once preferred before maybe generalized anxiety set in. Nonetheless, more research is still needed to be done to truly understand the impact that family involvement has as a treatment method for generalized anxiety disorder. So the goals of treatment. I haven't listed family involvement here because the goals would just to be to involve the family more. However, for CBT and psychodynamic therapy, the goals are a little bit more concrete. So for CBT, individuals will have decreased fear and worry of triggers, decreased negative self-talk and dysfunctional thinking, and will obtain the skills needed to help self-regulate and self-soothe when experiencing feelings of nervousness, worry, and or panic. According to CBT, it's all about developing the skills and restructuring of our thoughts to be most effective in decreasing symptomology of generalized anxiety disorder. Whereas with psychodynamic therapy, individuals are provided with the psychoeducation piece, such as the origin of the illness, the functions of anxiety, and they are provided with some coping skills about how to train individuals to reduce different symptoms that may come up in their life. But it also focuses on regulation of their medication involvement, finding the right type of medication for the client, and the right dosage that will be best suited for the client. So although they have their differences, they may be used in combination as well. Okay, cultural and environmental concerns. There are several different types of cultural and environmental concerns, but I listed the main ones found in research below. For socioeconomic status, individuals that are diagnosed with generalized anxiety disorder have an increased amount of diagnosis for individuals that are within lower socioeconomic status groups. This rate of diagnosis may be correlated to the ability for resources due to cost not being a factor in higher socioeconomic statuses. Lower socioeconomic status individuals often have higher level stressors in one's life, and they don't have as many resources within the community as well. For sexual minorities, when it comes to generalized anxiety disorder or GAD, lesbian, gay, and bisexual individuals are about 1.5 times higher than heterosexual populations to be diagnosed. This increase could be correlated to signs of stigmas and discriminations that's faced within this population of individuals as well. Lastly, for ethnic minorities, the rate of diagnosis increases in individuals that have experienced discrimination and face health risks in their lifestyles. So for example, foreign-born individuals tend to have higher rates of generalized anxiety disorder when they experience discrimination as opposed to their American-born counterparts. They also shown to receive less treatment. So foreign-born do not receive the same level of treatment as seen as their American-born counterparts. This may be attributed to cost, availability in their communities, and or stigmas, very similar to that of the socioeconomic status individual group. In regard to environmental concerns, there is different categories. I have listed 2 here: trauma and parenting style and sleep routine. For trauma, individuals that have experienced intimate partner violence or IPV are more commonly diagnosed with post-traumatic stress disorder or PTSD. And those that have gone through this and have experienced life-threatening situations are more likely to then develop generalized anxiety disorder in their life as well. So they do see a correlation between PTSD and GAD in an individual's adult life when he or she has experienced intimate partner violence. For parenting styles and sleep routine, this one is a little bit tricky. So, individuals that had a set sleep routine when they were a child and did not have any anxiety or worries about sleep as a baby tend to have less rates of GAD in their adult life. Those individuals that did not have a set sleep schedule and may had more anxiety and worry about going to sleep on time as a child tend to have increased rates of sleep disturbances and GAD or generalized anxiety disorder as an adult. So this goes back to their parenting styles. Parents that tend to be more attentive or routine based as a parent will produce children that have less rates of GAD. The different types of parenting styles are still being researched as to which maybe attribute to diagnoses of their children with GAD in the future, and more research still needs to be done to clarify that going forward. Lastly, for my conclusion, I want to bring forth awareness. Although generalized anxiety disorder is pretty well known within the community, especially within the United States, there needs to be more awareness on the ethnic and environmental populations that I mentioned in my previous slide, because individuals need to have the same amount of access to mental health services as those in higher socioeconomic statuses or if you're American born. Specifically, I want to highlight the socioeconomic status and the foreign born ethnic minorities because they're not receiving the same level of care because of stigmas within our society, lack of funding, and lack of access within their communities. And we need to bring forth awareness for reform and involvement of treatment within these communities. And lastly, knowledge. We continue to need more research in this field because there are so many different types of medications and dosages that can treat generalized anxiety disorder, but we need to research which ones work best. In addition, I want to bring up the family involvement piece. That one is not researched that well either. More research needs to be done whether family involvement may benefit adults, getting their families involved and their parents and siblings in their lives to help relieve some of those symptomologies as well. Overall, there needs to be more research in all categories of generalized anxiety disorder and within our mental health community. So thank you for watching today. I hope you learned a little bit about generalized anxiety disorder, and I look forward to watching your presentations. Thank you and take care.